At the conference today, I presented the Big Data for Small People project. It's a project based at the Children's Hospital at Westmead in the intensive care units and the operating theatres. The project's goal is to collect the data that we use to treat our patients, the physiological data, in a way that we can actually access for clinical and for research purposes in the future. Listening to all the talks so far today has been incredibly inspiring. I basically want to have a conversation with most of the people who've given talks. The digital health section was particularly relevant to our project, and we've already made connections there with Narinder and Clara in that regard. So it's a space that needs a whole bunch of people to work together to make any progress, and so that's where we're getting the help. One of the features that I think most defines success as a large precinct or a large organization is breaking barriers down between research groups. There's often massive expertise hidden away in little silos in research groups that don't necessarily talk to each other. So I think one of the things that this precinct and this conference is doing exceptionally well is to break those barriers down so that people know that there's expertise just across the way in some way that might be critical to advance a certain research finding. So the precinct itself and the hub itself are doing a great job in that area. The long-term success of any research area relies on buy-in from everyone involved in the area, and when you're dealing with healthcare research, that involves buy-in from the hospitals, the executives involved, the teaching institutions involved, and I think at Westmead we've got that buy-in from all of those people concerned. So the barriers there are diminished.